I'm Luke Story. For the past 22 years, I've been relentlessly committed to my deepest passion, designing the ultimate lifestyle based on the most powerful principles of spirituality, health, psychology, and personal development. The Lifestylist Podcast is a show dedicated to sharing my discoveries and the experts behind them with you. Dr. Bauman, I'm excited to talk to you, man.
I'm excited to be here. This is awesome.
This is great. I'm so glad we got to do this in person. You know,
For sure.
I like to track people down when we happen to be in the same city, and here we are back in my original home city of Los Angeles. There's on the other side of this curtain here, there's actually some really beautiful weather, which I'm enjoying as a Texan now.
Yeah.
Like, oh yeah, I remember why I stayed here for 32 years.
Yeah. I went to college in Southern California, UC
Oh, you did?
Riverside. Yeah. So I have a lot of friends and even roommates from college who
Oh,
are
I
here in
didn't
the
know
local
that.
area. So we'll be connecting with them
Right
this
on.
weekend too.
Yeah.
As well as with all the rest of the biohackers and such.
Right on, man. Okay, cool. Well, let's get right into it.
Sure.
So you're one of the leading experts in hair restoration, and I would say probably hair preservation too, if that's fair, right?
Absolutely. That's a big part of what we do, a huge part of what we do, right? Keeping the hair that you have as well as restoring hair that you lost.
All right, cool. So the first question I have for you is, what are the stats on women's concerns with this issue versus men? Because I never even realized until I started researching your work a little bit that this was also something that's problematic for many females.
Absolutely. So there's probably about 80 million to 90 million Americans out there who are dealing with hair loss. And it can happen to men, it can happen to women. And I think what most people don't realize is that, it can have a very strong effect on women. And there's no socially acceptable option for women with hair loss. And so 40% of my practice are female patients who don't want to lose their
Wow,
hair. And that's
that
always a
high?
surprising statistic for most.
I'm surprised.
Yeah.
For those watching the video, that's my surprise face.
Uh-huh.
Wow, that's interesting. Yeah, I guess I never thought about it. I mean, I didn't know that and didn't think about, my younger brother started losing his hair, I think, when he got sent off to college,
Mhm.
and so he just always had a shaved head. And I just know that's my brother Andy. He's got a shaved head, but
Sure.
for many females, that would be not a great option.
That's right. Not a socially acceptable option
Yeah.
unless you're Britney Spears, I guess, or Sinead O'Connor or something.
Yeah.
But those shouldn't be your hair heroes, right?
Right.
But yeah, so men lose their hair starting anytime after puberty, right? It can be a receding hairline, thinning in the crown, and we all know what that looks like. In women, sometimes they can lose 50% of their hair and it'll still look about the same, but they have to just style it differently.
Right.
But
So
it still has the same emotional effect.
when women lose their hair, then is it not so much like the male pattern thing? It just starts to thin overall rather than, getting receding hairline and the crown thinning and stuff? Is
Right.
it kind of more of a systemic?
So let's make sure we're talking on the same page. So
Okay.
androgenetic alopecia, which is male and female pattern hair loss, is the most common type of hair loss. That's the most prevalent. And yes, it looks completely different in men and women when it gets started. So as we said, receding hairline in men could happen anytime after puberty. But for women, when they start losing their hair, sometimes it's just a volume issue, or they're seeing excessive shedding, or they're losing some coverage like in a part line in the front of their scalp. Usually it happens mostly in the front for women first. So it's a totally different look than someone with male pattern hair loss.
Right, because
over time, it
I
can
don't
recede
see
too.
women that have my hairline.
Right, exactly. But women can recede as well. As they age and they go through perimenopause, menopause, and become postmenopausal, their hairlines can change and can recede backwards. So we do have a lot of women that come to us to look for a more youthful hairline, whether it's density or even location. And then, of course, there's other things that could change the hairline in women, for example, like brow lift surgery, things like that.
Oh, interesting. Okay, cool. Yesterday here at the conference, I stopped by your booth and you had some diagnostic tool with video screens and stuff like that. And I reluctantly sat in the chair and had a little diagnosis. It wasn't as bad as I thought it might have been, but tell me a little bit about.
It didn't hurt.
No, it didn't hurt.
See, it's just an evaluation. It's just like listening to your heartbeat, okay?
But like when you see a magnification of your scalp,
Right.
it looks like there's very little hair there.
Yeah.
And I, obviously for anyone listening and myself, I know this is like a vanity issue and one's self-worth hopefully is not derived on, how much protein they have popping out of their scalp. But yeah, looking at that, I was like, ouch. So what is that diagnostic tool? How do you use it? How long it's been around? Stuff like
Yeah,
that.
so the tool is really exciting. It's the first AI-powered microscope. It's called Hairmetrics, made by Canfield, and what it enables us to do is we can take a small microscopic photo of the scalp, it gets sent up to the cloud, and it comes back with a hair density measurement, and also it sorts all the hair in terms of caliber. So if it's a thick hair, over 90 microns, it's gonna go in this category, and it's tagged this color. If it's 60 to microns, a little bit smaller, it's in this category. If it's 30 to 60, it's in this category. Less than 30, it's red. No bueno.
Yeah,
Right?
yeah,
So
yeah.
basically, up
Luckily,
on
I
the
had a lot
screen,
of green on the screen, so I was like, okay.
yeah, green and dark green, those are the colors, that you want to see on the microscope. When it gets to yellow, that's miniaturized or smaller hairs. And then, of course, red, not a great hair. So we use that tool to track your current hair loss status. So we'll look, for example, in your case, maybe the difference between the more permanent zones in the back of the scalp compared to areas that you might see some thinning, or maybe areas that are at risk for thinning and you don't even know what's going on in that zone. So it becomes not just a diagnostic tool initially, like what's going on and where, but also a benchmark, right? And as a biohacker, you want to know whatever intervention you're doing, is it improving? How much is it improving? And where? And that's what the measurements enable us to determine.
That's cool because what I'm starting to understand about the whole hair restoration thing is that on the patient's part, the compliance is really important, right? And we'll get into some of the topicals and lasers and red light and stuff. But from what I've looked into it, it's not just like you go to a specialist and they're like, pour this cream on your head every night and you're good to go. There's, protocols that one might want to adopt if they're pretty serious about keeping what they've got, right? So I think a diagnostic tool like that is really cool because it's kind of a reality check, right?
Oh,
And then
absolutely.
also motivating to keep you going if you're like, Ian Mitchell, who was on the show before, I think I might have introduced you to him
Yeah.
some months ago. He made this, I think it had GHK peptide and C60 in it, and
Hmm.
he sent me some of it with the derma roller and
Hmm.
said, put it on for 20 minutes and get under the red light. And I did it a few times, but it was really difficult, to keep up with that practice.
Right.
And even more so because I didn't really know. I mean, I trust him that it's going to work. He showed me some before and after pictures
Sure.
and stuff, but without me being able to see it on myself, it's kind of like, has to be refrigerated, So I
Mm,
don't think of going to the refrigerator at 11
right.
when I go to bed. So
Yeah, I think that diagnostic tools like the hair metrics and other things that we do, hair check measurements, it's another way that we can track what's going on, enable us to keep you honest over time, and also determine what's working and what's not, because every patient is different. If you're not getting a response from the first line therapies, well, that's when we have to dig deeper and maybe go into something else. Or if you're having an issue with being able to put the medication on your scalp, let's say it's a topical and it was like messing up your hairstyle. That's not good. So let's find some other way to get that medication or another modality, and we can shift gears.
right on.
Yeah.
Let's talk about the causes of hair loss. There's
Mm.
a lot of misinformation out there, and it gets very confusing. I mean, if you just do a web search, what causes hair loss? You're going to get lost in all kinds of rabbit holes that
Oh, yeah.
probably will take you nowhere quickly. So, hereditary, dietary, like what from your perspective is actually at the root of this?
Yeah. So a hair follicle is a very, very highly metabolic organ, right? And the niche, which is all of the neighborhood cells that are in the area, which includes the adipose tissue, the blood supply, nerve endings, a little muscle that makes it pull, all of these different things have an impact, both locally and distant, on the follicle. So your lifestyle, your habits, your nutrition status, your stress level, your sleep wake cycles, all of that, and including hereditary risk factors, form the basis of what's going to be happening to your hair over time. So when we talk about hereditary hair loss, that's the DNA. That's going to be your genetic sensitivity to certain hormones in your body. So as you age, those hormones are degrading the hair follicle function. The hair follicle is going to weaken over time. But all those other lifestyle factors can also have an impact. Now, how much are the lifestyle factors versus the hereditary factors affecting your hair? Well, it's different for every person. It's different for men versus women. For example, women may have more sensitive hair follicles. So, an issue with their nutrition might impact the hair more drastically, more dramatically than, let's say, a male patient. And then there's all the other things like illness, COVID was a huge trigger for hair loss over the past 2 years.
Really?
The mRNA vaccines, which
Huh.
dysregulate your immune system. So there's an autoimmune component to hair loss. And the microvasculature, right? The spike protein can sometimes dysregulate that. Um, so
So
there's
business has been booming at your
well,
practice, I
look,
bet.
I treat about 1,500 patients per year through the door at Bauman Medical. We've treated over 30,000 patients, and the practice has always
Wow.
grown over the years.
Yeah.
And it's been pretty crazy. I mean, I've personally treated over 1,000 COVID-related hair loss patients over the past,
Wow.
18 to 24 months.
I guess that has a lot to do with the metabolic drain, as you were saying, the requirements of energy to keep your hair going. And if your energy is being depleted by some illness, that makes a lot of sense.
Yeah. I
Wow.
guess that, and that brings us to even some of the types of therapies. People say, oh, well, it's just the genetic sensitivity to this body's hormone, which is the DHT for men. That's the primary trigger. But yeah, I mean, there are first line therapies that handle that issue. But then, behind that are all the other things that we do in the practice, to take a more holistic approach, if you will, lifestyle approach and functional medicine approach to hair
Right.
loss.
Yeah, I was perusing your website and saw that you had a lot of information about just functional medicine and lifestyle choices and things like that, which is cool. Are there a lot of people out there doing what you do that are able to approach this surgically and also incorporate so much of the lifestyle, or are you kind of unique in that sense?
Yeah, I think, first of all, I've always been kind of a unicorn in the field because I've taken a very proactive approach dating back decades in terms of prevention. So, not just a hair transplant surgeon, I'm not just board certified in hair transplant surgery. I feel like I'm a hair restoration physician. And that was a term that really wasn't used over 20 years ago. But because we used medications, medical therapies, and I was one of the first to recommend low level laser light therapy or
Oh, really?
photobiomodulation back in 1999. I got my first
In
laser devices.
99? Wow.
Yeah, we imported the first laser hoods in 1999 from Sweden.
Wow.
Yeah, and a lot of the textbook was written by, like, an acupuncturist, describing how laser therapy works on the skin. But we saw great results with those in-office treatments, but obviously the patients had to come back in, several times a week to get the result.
Right, right.
So
Back
I've always been very proactive. I guess
Yeah,
that's important. So
yeah.
taking care of the long-term issue of the ongoing progression as we age, right? Protecting the follicle function. And of course, if the follicle's missing or gone or, too far gone, if you will, but, you can't be rejuvenated, then that's when the transplant comes into play.
Okay. I definitely wanna get into that because I was watching some videos on that, and I'm like, "Whoa, that is probably the most tedious thing I can imagine doing." It's just
Hair by hair? Is that
Yeah,
what you're
yeah. I
talking
mean, I know
about?
you've got some robotics and stuff, and we'll get into
Yeah.
that, but, I'm gonna go back to the hereditary element.
Mhm.
Is there any truth to this that, you get hair loss from your mom's side of the family, or is that just, like, folklore?
Yeah, they used to say, like, your mother's father will
Right.
determine your follicular fate, and that's certainly not the case. We know that there's so many different contributions today when it comes to what you inherit from your mom's side or your dad's side, the color, the curl of your hair, the thickness of the hair. Whether you're gonna have male or female pattern hair loss and other conditions that could affect the hair follicle can come from both sides of the family. The onset, when is the hair loss gonna be visible to the naked eye? How fast is it gonna progress? All of those things are hereditary. And one of the things that we do now is actually some deep genetic testing to determine different metabolic pathways that might influence hair follicle function or make some treatments better than others for you.
Oh, wow, that's
So,
cool.
we I did genetic testing for hair loss risk over 10 years ago. It was the first genetic hair loss risk test that was available, and also androgen sensitivity testing, something that you can do looking at the DNA. But today, the tricho test is definitely the deep dive into the metabolic pathways of hair loss. And so that's the personalized precision medicine approach to the treatment of hair loss that we have today.
How would someone get this tricho test?
So tricho test is easy to order on the website.
Oh,
It's not a
okay.
big deal. But the problem is that the results of that test are not so user friendly. So it's not really direct to consumer. I would say it
Okay.
needs a little bit of interpretation. It needs to be looked at in terms of first line therapies, second line therapies, and taken in conjunction with whatever your lifestyle factors are, therapies you're on currently, things that you've tried or failed on in terms of hair regrowth. So I would just I would caution your listeners, like, if you want to know that genetic information, get the test, but it also comes with the consultation.
Oh,
So, like,
okay.
let me interpret it for you and,
Got
and
it.
go through the
Got it.
process.
And you guys have that test available?
Yeah.
Okay, cool. And before I forget, if you guys go to lukestory.com/Bauman, Bauman, lukestory.com/Bauman, you'll find any resources and offers and things like that we talk about here. I didn't even know you guys had that. That's cool.
Yeah.
Then with the hormones, kind of in the functional medicine realm here, many people listening have probably by now had their hormones tested, and they're looking at all of that and adjusting their supplementation and diet and movement and all that. Is there any kind of universal low-hanging fruit in terms of if your hormone panel looks like this, like your central or main hormones, you're going to have issues with hair loss? Like if I had my testosterone and my free testosterone check, for example, could you be able to tell something just from that and tell someone, okay, you need to work on raising your testosterone?
Yeah. I wish there was a simple biomarker for hair loss, like just a lab test, that
That's
you could
what
just
I'm
go,
looking for,
yeah.
man.
Okay, so here's the thing. So
Okay.
testosterone gets converted into DHT, dihydrotestosterone in the body. And when you're sensitive to DHT at the level of the hair follicle, that's the trigger for miniaturization. So DHT is the culprit.
I don't think any male would like that term, miniaturization, by the way.
Right. No, you don't want anything to miniaturize, right? Nothing. Everything's got to be growth.
Yeah.
So miniaturization is what occurs at the level of the follicle in a response to DHT. And how fast or how quick that happens, that's what the hereditary genetic tendency is going to elucidate. But there's other hormone dysregulation that could occur that could affect your hair. In women, sometimes we see thyroid abnormalities and other issues. So a deep dive into your biomarkers can help figure out what's going on. And once those hormones are optimized, let's just say you're a male patient, you're in your 50s and you're on hormone replacement therapy, be mindful that if you're supplementing your testosterone to bring it back up to normal range or better, that's going to convert to DHT. So you could have been decreasing your natural DHT production over time just by getting older, and now that would have been good for your hair or slowing down hair loss. And now you're increasing your testosterone exogenously, right from the outside. You're injecting creams, whatever, and then that's getting converted to DHT. That's going to miniaturize your hair maybe faster.
Oh,
so if you're on hormone replacement, let's say with pellets or something, and you let's just say get overdosed or you receive a lot of testosterone, which sometimes happens with pellet stacking, you can trigger a lot of hair loss, not every time, but sometimes if you're overdosed and if you're super sensitive to it. So that's where the genetics can sometimes sabotage you, right? And also if you're not really carefully looking at your testosterone levels.
Tell people about these pellets. I forgot about those. I've never tried them. But some people probably won't know what that is.
Yeah, I'm not an expert in hormone replacement therapy, but you can get testosterone replacement with a cream. That was probably the first thing that happened. Androgels, right? And then injections. That gives you kind of a slow dose, right, over the week. Some people do it once a week or twice a week. And you can also have pellets implanted. So these are slow-releasing testosterone pellets. And if you're really low on testosterone, you may get 2 or 3 pellets at a time, potentially initially. And then, oh my gosh, if you're God forbid, overdosing on it, right? Maybe you're having accelerated hair loss. And this can happen in women too who are getting hormone replacement therapy, because women get testosterone replacement as well for all different great benefits, right? But if a woman is sensitive to female pattern hair loss, that extra testosterone pellet can sometimes cause a recession of the hairline, thinning throughout, shedding, other symptoms. So,
got it.
The good news is that the pellets wear off. And so just, if that happened to you, it's okay. Just let those pellets, wear down, and then don't do too many stacked on top of one another, right? Be a little bit more mindful about that. And let's get on some kind of therapy to help block that DHT effect. Right? So there's medications.
How would one do that? Oh, there's medications?
Yeah. So medications are one of the primary therapies, right?
Okay.
So finasteride has been available in the form of Propecia years ago. It was the first FDA-approved oral medication for male pattern baldness. It can also be used in women postmenopausal, but it's dangerous for women of childbearing age because of a risk to the developing male fetus. So it is a prescription medication. It should be used with caution, but know the risks and the benefits. Talk to your hair restoration board certified hair restoration physician about that.
I think a lot of people listening to this show probably think anything pharmaceutical is all risk.
Yeah.
What I mean?
Well, let's talk about that.
But I think about something like Accutane, right? One of my brothers, not the one who lost his hair, but the other one, when he was a teenager, he had acne, he used Accutane, and it jacked him up, and at the time it was like a godsend, right? In terms of the benefits, but we don't know the side effects until sometime later. But
Well, Accutane is notorious for hair loss. So a lot of patients come in having used Accutane as a teenager for acne, and then all of a sudden their hair is doing terrible.
really,
Yeah, so Accutane is awful for hair regrowth. I mean, it's just terrible. But let's talk about finasteride because I
okay,
know, yes, your viewers, your listeners may be totally anti-pharmaceutical, but again, they're going to dig into, well, what exactly does this pharmaceutical do? And what are the real risks and the benefits? And sometimes that's where it gets confusing on the internet, right? Because
yeah,
all of a sudden you see a very small percentage of patients who have side effects, let's say 2% that have side effects. Well, 2% out of millions of patients, I mean, that's a lot of noise on the internet, right? And so what are the benefits of being on finasteride? If you're a male patient, why should you consider finasteride as soon as possible? Well, because it's the strongest tool in the toolbox. It's the
is it
strongest
really?
treatment that we have
Oh wow,
because it reduces that DHT level, which would then protect the follicles, right?
okay.
90% of folks on that medication get a positive effect. That's pretty good for a pharmaceutical, 90% success rate.
It's a lot better than many of the popular ones right now.
Yeah, for sure. And even, our preventative therapies, right? For,
Yeah,
our favorite virus. But anyway,
yeah.
my point is that uh, finasteride orally at the correct dose works 90% of the time. 5 out of 6 guys are going to stop losing hair. 2 out of 3 are going to see some regrowth. But what are the risks? 2% of patients are going to see mild and temporary sexual side effects. So those side effects could be decreased libido,
Isn't that
could be
funny how
mild
that
erectile
works?
dysfunction.
I'm thinking this guy's like, man, my hair looks great. I got a date tonight. Oops. No, I mean that's
Yeah,
the ratio there though is pretty good. Side effect versus benefit,
right.
and to be fair to the pharmaceutical industry, I mean there's times where I'm happy to take drugs or go see an allopathic doctor by all means.
Mhm.
Sometimes you need it. You need the big guns, and
Yeah.
it's worth it.
So the good news is that if you did, let's say, have a side effect, let's say you tried finasteride or Propecia when it first came out, and let's say had a side effect, we can actually now apply that medication topically through compounding pharmacy. So you don't have to take it orally. There's no major systemic absorption,
Oh wow,
much less risk of side effects, almost negligible, and still get a powerful hair regrowth effect right on the scalp.
wow,
Yeah.
that's
So
badass.
that's the nuance, right, that we
Mm-hmm.
have
Mm-hmm.
today that, sometimes gets lost in the noise on the internet, about, oh my God, it's anti-finasteride. I can't, we can't take
Yeah.
finasteride at all.
With this, was it FHT?
DHT,
DHT.
dihydrotestosterone,
DHT.
DHT. That's the bad guy.
Okay, with the DHT, if your hormones are dysregulated, too
Mhm.
much, too little of that, whatever, and you're having that go on, and you talk about like losing that hair, if that follicle loses a hair, does that by definition mean that it's toast forever unless you did replacement?
No, let's talk about what happens at the level of the follicle
Okay.
because there's some misconception about like when the hair sheds out that like, oh my God, the hair is gone. Well, that's not really how the follicle works. Hair follicles have cycles. They turn on and turn off. And over the course of your life, they're going to go through a growing phase, right? A hair production phase. Think of it like a 3D printer making a hair fiber. The hair fiber is dead tissue, kind of like your fingernail, right? And the follicle's under the skin making that fiber. It's going to work for about 5 to 7 years. That's the anagen or growth phase. And then it turns off and takes a rest. And it takes about 90 days for it to reboot. They call that catagen and then telogen. And so telogen is that resting phase where the hair is shed in between telogen and the next anagen, right? So the shedding is going to happen every single day. About 100 to 200 hairs from a healthy scalp is normal and is not super concerning.
Really?
But if you're
God.
seeing some increase in shedding, more hair in the drain, in the brush, in the bed pillow, whatever, then you need to take some action, get some measurements going on.
Okay, cool.
Yeah. But
Cool.
so my point is that when DHT is affecting the follicle, each successive cycle of the hair follicle becomes shorter. So what happens? You get a miniaturized hair. You get a shorter, thinner, weaker, wispier hair over time. And then eventually the hair is so short, so depigmented, that follicle can never be rejuvenated. It's like beyond repair. It becomes like a follicle that you have on your cheek. It's invisible
Sure,
to the naked
sure.
eye. It's just producing what they call a vellus hair.
Okay. And it
That's no bueno. That's not
okay.
good. Yeah, you wanna
Yeah.
try to prevent that.
And so if you've gone to that stage, then surgical restoration, transplant is going to be your only option, really. Like
Correct.
there's no bringing that back once it gets to that point.
Correct, correct. But
Okay.
we want to dovetail. And, look, if you're not going to be doing pharmaceutical interventions, and maybe you're doing red light therapy, maybe you're doing those lifestyle changes, trying to get better sleep, better nutrition. Maybe you're doing a regenerative treatment like PRP, platelet-rich plasma, or PDO grow, or exosome therapy to stimulate those follicles, without surgery. So you don't want to let it get to that point. But
Mhm.
yes, the vellus hair is the point of no return.
Okay.
That's when you're going to need some degree of transplantation to
Okay.
fix the
Okay, cool.
density issue.
Have you heard anything about parasites being the root cause of hair loss?
Parasites.
Yeah.
Well, um, I don't come across a lot of parasitic infection in my practice, so
Okay.
I can't speak from personal experience. But I would imagine if something is affecting your health, right, and your body is fighting off a parasite, or maybe if it's a gut parasite or something, and you're having poor digestion, you can imagine there's a whole domino effect of health related
Right.
effects from
Right.
that. And hair follicles, remember we talked about that, super sensitive to inflammation in the body,
Mhm.
to dysregulation, sleep-wake cycles. So there's so many different things that could basically screw up your hair production, right, and turn off that 3D printer, right? So I'm not wouldn't be surprised.
Yeah. I
Infection
think
can cause it. I mean, look, whether it's a
okay.
viral infection, bacterial infection, parasitic infection, if your body's working to fight something else, then it goes into kind of a defensive mode, and it directs its attention to those more critical functions of the body. And that's one of the reasons why we see hair falling out from all different reasons.
Okay, cool.
Yeah.
That makes sense. Yeah, someone mentioned that to me as a possibility, and I
Hmm.
believe, if I remember right, it was related to mineral regulation, and that the parasites are going to gobble up a lot of your minerals, and that was kind of the cascade effect of that. So,
Hmm.
but the way you frame it makes sense. It's like anything your body's fighting against and struggling with is less energy it's going to have to do its job, which is to put hair in your head, or at least one of its jobs.
Yeah. Always think of hair. I tell my patients, hair is kind of like the luxury item of the body.
Right.
Like if something's going wrong, like all of a sudden you're not going to make hair, right? And so why
Yeah.
is that? I think that hair is like just a very, very important barometer of your health. It's a
Hmm.
very, like I said, a highly metabolic, sensitive organ. It's rapidly dividing. I mean, it's one of the most highly metabolic cell populations in the body. Think about if you went on chemotherapy. What happens? Your gut lining starts to shut down, right? Highly metabolic and replaces itself every day. Your bone marrow, right? That's when you start to get anemic and your immune system gets shut down and your hair falls out. So why are those three things affected by cancer therapy? It's because they're all highly metabolic.
Interesting. Okay, you mentioned loss of pigmentation, and that wasn't even in my notes. But now that you mention that, what do you know about people going gray?
Yeah. So wow, it's prevalent, right? And hair color industry is a gazillion dollar industry, right? I mean, it's big, right? It's huge because people want color to make their hair look more youthful. And so it's obviously desirable, right? So just like people want a healthy looking head of hair in terms of volume and quantity of hair, they also want, and that's normal, right? We're hardwired for that because hair makes us look good and feel good. Most of the time, as our hair starts to change or lose its color, people want to either try to figure out why, fight against that. Um, the bad news is that there's no like miracle cure for going gray, right? But we think that there may be things that are been studied in the research that kind of elucidate what's going on at the level of the hair follicle. So the bottom line is that yes, hair color is kind of the quick fix for that, but chemical processing and using color on your scalp can have other effects. These extrinsic effects on the hair follicle can seep into the skin and be not so good, dysregulate the hair follicle as well. What are the kinds of therapies that they've seen in the research lab that work? So there's been a lot of studies on catalase. There's been some studies on rapamycin and hair pigmentation. And a lot of this research is just in the primordial stage. So I would say if someone is out there looking for some cure for hair color, just be careful. There's a lot of snake oil out there. There's
Yeah,
not a lot of solid scientific studies that show that these things work.
there's even like I
Copper
think.
peptide is one of those that kind of comes up a
Oh,
lot.
okay.
The old fashioned and ancient Chinese he
He
show
show Wu.
woo,
That's what I was
you know,
gonna say.
he show woo.
And there's
Mr. Dark Hair,
yeah,
that's
yeah.
it. That's what he show woo means, right? It's Mr. Dark Hair.
I was going to mention that in Chinese
Yeah.
medicine, and you hear things about Shilajit and different kind of Ayurvedic and Chinese medicine herbs and
Yeah.
things like if you take this, you'll never go gray. And
So I'll tell you just from my experience of been to Beijing, there's a lot of people with gray hair there. So I don't think the Chinese figured it out. Maybe
okay,
it's lost in translation somewhere, but
right,
yeah, I don't think they figured it out yet. They still
right.
got a lot of gray hair over there.
Speaking of hair dye and permanent solutions, hair
Mm.
straightening solutions,
Mm.
do those have a negative impact on the volume of hair and hair loss?
Well, absolutely. Those kinds of chemical solutions can have a detrimental effect on scalp health. And so we know in certain populations that do relaxing agents, for example, for over and over and over again, African American population will use relaxing agents to straighten the kinky hair, so it becomes more manageable, easier to use, easier to deal with, and for aesthetic purposes as well, they may want to change their hairstyle. But the problem is that overuse, consistent use of those kinds of relaxing agents can cause a lot of damage at the level of the scalp, and that causes other types of alopecias, other types of hair loss, scarring alopecias.
Oh, really?
Yeah, and where the
Yikes.
follicles are completely obliterated, replaced with scar tissue, and in many cases, it's very difficult to restore those areas even through transplantation
Oh,
if the
no
skin has
kidding.
been damaged in
So
that
it's kind of
way.
it's
Yeah.
like a burn almost. It sounds like
Yes,
chemical burn.
yes, that's what we think. There's a chemical burn component to those
What about
chemical
hair?
treatments.
What about hair lightening? People want to go blonde or platinum and stuff.
Look, so in my practice, obviously, I told you 40% of my patients are women, and most women do color their hair. So I would be in pretty big trouble if I told all my women, hey, you can't color your hair. So we know the aesthetic value of hair color, and we know the aesthetic value of um, treatments of your hair to change the curl, whether it's you're straightening it or curling it. So I would just say you have to use those treatments carefully and monitor your scalp health. In fact, at Bauman Medical, we have a complete department. That's all they do. My trichology department and trichology lab monitors and evaluates and optimizes scalp health.
Oh, really?
Yeah. So
You
that's
guys are
I have
hardcore,
a
man.
I have a full department.
Wow.
I have a certified trichologist, certified hair coach, Kim Jenkins, and she can do measurements of your scalp that include pH level, moisture level, sebum level. We can look for microorganism overgrowth and things like that, and figure out what's going on. So if patients who are out there are people with scalp symptoms, right? Itchy, flaky, dry, oily scalp. Let's evaluate that, figure out what's going on, because that can impact the hair growth as well.
Oh, wow. Well, you said microorganisms. Are people having microorganisms in their scalp?
Scalp? Oh, yeah.
Yeah.
So the scalp contains, just like the skin, a microbiome, right?
Okay.
So we've talked a lot about microbiome of the gut.
Yeah.
Well, there's a scalp microbiome as well. And when there's an overgrowth of certain microorganisms like yeast, for example, that's the primary trigger for dandruff. Seborrheic dermatitis is an
Ah.
overgrowth of certain microorganisms where when the diversity reduces, you get overgrowth of one species. That's what's triggering this seborrheic dermatitis, which is inflammation at the level of the scalp. These microorganisms feed on the exfoliated skin cells and the sebum that's being produced,
Oh,
and
man.
there's different therapies and treatments for that. And
Okay.
sometimes it's an incidental finding. The patient comes in with hair loss concerns, and we're digging through the scalp. We're like, geez, your scalp is inflamed. It's flaky, dandruffy. He's like, yeah, yeah. Sometimes I see that. Well, let's get that fixed before we start with hair growth treatments.
Got
That's
it.
like foundational.
Yeah. Yeah.
Got
That
to
makes
fix that
sense.
first.
Do you think that excessive use of a hair dryer, even drying one's head with a towel, is going to have any long-term negative impact on the volume of your hair?
Again, there's aesthetic value to using a blow dryer to dry the hair. Excessive heat can actually dry out the hair fiber and make it more prone to breakage. But you don't want to style your hair when it's wet either. It's more fragile at that time. So we actually, at one point, had special types of towels.
Oh, really?
Yeah, that we would recommend, almost like turbans to absorb the water, just kind of be more gentle with your hair. And I think it's just a good plan if you're trying to grow better, thicker hair, and your hair is like prone to be fragile, that you better just be careful with it, whether it's heat or how you dry it or how you style it, what chemicals you use. You know, that's a reason to chat with either a board certified hair restoration physician or my trichologist to
Okay.
handle those kinds of questions.
Cool. Yeah, I just
Yeah.
as I've gotten older and my hair starts to thin, I notice I get out of the shower and I'm a little more ginger about the way, I
Yeah.
dry my hair with the towel. I used to just like scrub it, and get out of there. And now I'm like,
Yeah.
oh, pat it down a little bit.
Well, I mean, you may be going overboard. Let's be
Okay.
honest. But,
Okay.
because some degree of scalp massage can actually trigger hair growth. There's some actual studies that show that mechanical manipulation of the scalp improves hair growth,
Oh,
improves circulation.
right,
So,
right.
you may be thinking, oh, I'm just going to treat my hair more gently.
Yeah.
And for women, especially, sometimes they decide, well, I'm not going to comb it out. I'm not going to brush it out, or I'm going to put it in a ponytail or whatever, really light ponytail. And then when they take out that ponytail or they decide to shampoo and brush it out, it's like they got a handful of hair, and they think that that's severe hair loss, but actually that's just all the hair that would normally have shed each day that they wouldn't normally notice a lot of it. Now it's all in one spot,
Oh,
one day,
interesting.
once a week. It's like 1,000 hairs.
I
They're
think
padding.
we forget that you're going to be losing hair all the time, even if you're not set for, some sort of pattern baldness. I mean, when you look in the shower drain, right, every couple of weeks, it's like, where'd all that come from?
Yeah. Shedding can be a disturbing symptom, right? Because it's like the physical embodiment of the hair leaving your head, right?
Yeah.
That's not a good feeling, right? Nobody wants to
Right.
see that in the shower drain. But remember that treatments like laser light, even platelet-rich plasma, the regenerative treatments, or starting a prescription minoxidil, a topical medication, can trigger a shedding phase as the new hairs are coming in and pushing out the old ones. So a lot of people stop their regimen right at the time that it's working because they mistake the shedding as
Okay.
loss, when actually that's the symptom of the regrowth that they're getting from the therapy.
Wow. God,
That's why the measurements are critical.
yeah, and I can see there's a lot of education needed in this if someone's kind of serious about going down this path. It's
Yeah.
like you need someone like you who knows what they're doing that can guide you, because you could freak out, or be like me and not want to towel dry my hair too hard, and you're like, you're probably
You're
all
okay.
right."
You're good. Yeah. Yeah. Luke, you're okay, man. You can go back to towel drying your hair.
That's hilarious.
You don't. I don't think you need a turban at this moment.
That's
You're
hilarious.
doing okay.
Back to the nutrition piece. Are there any just universally positive supplements one can take that are known to support, just the strength of your hair, longevity of your hair?
Yeah, there's a lot that we can do. So, I always ask my patients, are you on some kind of caloric restrictive regimen? Are you on some special, and I say extreme diet, and we all know what these are, right? So, if you're doing extensive fasting or things like that, you may actually be protein deficient, and you need protein to grow hair. I mean, that's what the hair is. It's keratin protein. So if you're protein deficient, you're not going to be growing good hair at all. So we do recommend our own collagen peptide supplement. That's
Cool.
It's called the Builder. It's under the Bauman brand, and it's part of our wellness system for hair. And we have like a number of different components to that system, but that's one of the foundational ones.
Awesome.
It's simple and easy. You can throw a scoop of collagen in your, coffee, your tea, your juice. You can throw it on whatever, your oatmeal, and you're going to get that boost of collagen peptides.
Awesome.
Yeah. So I think that's foundational.
Okay.
I also like a multivitamin, B complex. Biotin is also a good supplement. Those are some of the basics. Now
Okay.
we can get more nuanced with nutritional supplementation in terms of probiotics, which regulate the immune system, right? Because we don't want to overdo. We don't want to have an overblown immune response to anything. We want to keep that tamped down in our health. And we also want good absorption. So we have a probiotic called the Good Guys. There's other nutritionals which I would consider more like defensive, right? So things that boost your immune system so that you don't get COVID or less likely to, perhaps, so that you stay healthier, or things that are like stress adaptogens like ashwagandha. These are more nuanced Ayurvedic herbs and things like that we
Okay.
have. That one's called the Zen Master. So there's a whole variety of things that we have in my particular system to address not only like a positive impact on the hair, but also like a defense, right? To kind of hold off these other influences.
For sure.
Yeah.
Okay.
But look, you want to make sure you're not iron deficient, and that you have a well balanced diet, and that goes along with all the other lifestyle factors, right? That you're sleeping well and taking care of yourself and being mindful, and get that stress cortisol under control.
Yeah.
Spike it when you need it, but get it down when you need to. That you got to get that
Yeah.
stimulation and then the rest and digest at the same
The
time.
stress and hair loss thing is definitely real, because I noticed I had a really stressful year and a half, which I'm now maybe a few months out of. moving my life to Texas and
Mm-hmm.
renovating the house and stuff, man. And I could swear, I mean, you don't know if it's causation or correlation, but I'm like, I definitely lost some hair in that period more so than just like aging another year and a half because I was so stressed out and just so busy. You know, I think there's a lot to be said for just the lifestyle part of it, right? If you're using ashwagandha and getting your magnesium up, and you can do that, but there's a certain degree of commitment one must have to meditation and breath work and just learning how to self-regulate so you're not in
Oh,
that
yeah.
fight or flight, high cortisol response all the time.
Yeah, for sure. I mean, there's no question that we see patients who are under physiologic stress or perceived stress, which is psychologic stress, experience hair shedding phases. So, shedding, we've talked so much about this, telogen effluvium, I want to make sure I get the terminology out there, is a synchronized shed. And that can happen if you have a high fever, infection, as we've talked about, childbirth, a general surgery operation, or a change in residence is a very, very common
Oh,
trigger.
really? Oh,
Yeah,
yeah.
that's literally
That's
on
funny.
the list,
Wow.
or job change,
Right,
right?
right.
Or change in marital status, change in financial status. So these are all major stressors, right? That things that keep us up at night. We don't eat the same, we don't take care of ourselves the same. When these things are happening, we're in a state of flux, right? And so our body is a little bit out of balance, and that can definitely trigger a shedding phase. Now, how
Okay.
quickly you rebound, if you do rebound, that is determined by your baseline genetics. Because, for example, I have patients, right? They have, a female comes in, uh, had a baby 6 months ago. They're done nursing, all this business, and they had a massive shed 6 weeks out from childbirth, and the shedding is still going on, and maybe slowed down a little bit, but it's kind of revealed this underlying. And so we would hope that that would resolve, right, and everything would be back to normal and great and good within the next year. But sometimes it doesn't happen. So why is that? Why did that, childbirth effect reveal an underlying tendency towards female pattern hair loss? We don't really know the answer, but sometimes it's like as you stack these things against the hair follicle, sometimes you have more than one diagnosis.
Right. Multifactorial.
Yeah. So
Yeah.
COVID, all of a sudden,
Yeah.
their male pattern hair loss was going slowly, slowly, slowly. Then boom, COVID twice in a year. And now it's like accelerated dramatically.
Right.
So what are we going to do about that? Well, some of that hair might be beyond repair. It's not going to bounce back without therapy.
Okay. All right. Let's get into then I think maybe let's get into some of the topicals first. I know you
Sure.
guys are doing some really interesting stuff.
Yeah.
And then we'll close it out with when you really need the big guns and you're going to be getting into the surgical zone.
Mm-hmm.
So some things that I've used or heard about, and you mentioned a couple of these would be peptides, and of course the PRP stem cells. And then you guys are using something you alluded to earlier, PDO grow. Explain, kind of how this stuff
all fits. Yeah.
Yeah, all this kind of stuff that
So
can
sometimes,
actually be injected or microneedled into the scalp.
right. So sometimes when people say topicals, they think of Rogaine, right? Because
Oh,
you can
okay,
buy that
okay.
they buy that at CVS
Okay.
or Walgreens, right? So
Right.
obviously there's compounded topicals.
Does that work, by the way?
So Rogaine contains minoxidil,
Okay.
right? But the problem is that a lot of folks don't have the enzyme activity in their skin to convert minoxidil to minoxidil sulfate. So about 30 to 40% of people don't get a great response from over-the-counter Rogaine.
Oh, okay.
We can figure that out through the tricho test, as we mentioned earlier. That sulfotransferase activity metabolic pathway is one of the things that the tricho test looks at. Or we could prescribe something that ramps up that activity in the skin, like a compounded version of minoxidil. So our quality compounded minoxidil concoctions, if you will, are always going to be more powerful and more well tolerated than the over-the-counter.
Okay.
We're going to eliminate the irritating ingredients. We're going to include other ingredients that potentiate or increase the hair growth response. We can even put finasteride in the topicals, as we talked about before.
Oh, cool.
So that's kind of that, pharmaceutical stuff, right?
Got it.
And then, the other topicals that you mentioned would be like peptides. So peptides can be applied injected. They can be applied like as a cream or a serum, and they can also be microneedled in. We have a newer technology now that can actually push peptides through the skin at high volume without a needle.
Do you have one of those downstairs?
Yeah, so
okay,
that's
yeah, I was
TED.
looking at that.
Yeah, so that's TED. So that's like the least invasive in-office therapy that you can dream of.
How does it do that without breaking the skin?
Yeah, so it's really cool, brand new technology. So ultrasonic waves, which are sound waves, are the same types of things that you use like as a jewelry cleaner or, ultrasonic toothbrush,
Sure.
you know that buzzing sound, right? So those are ultrasonic waves. And what they can do at the correct frequencies is break up the stratum corneum temporarily. So for your followers and listeners, the stratum corneum is that moisture barrier of cells and lipids that's just, microns under the skin, the very, very top layer, just under the dead skin cells. There's a tight moisture barrier. It's the reason why when you like go in the shower that the water rolls off your skin and you don't absorb it like a sponge,
All right.
So when you use ultrasonic waves, it disrupts that brick and mortar barrier temporarily. And then
Wow.
that ultrasonic system, that ultrasonic delivery tool can also help push the serums with pressure right through the skin. So it's
Wow.
doing kind of two things. You can prime the skin, right? Make it more permeable temporarily. You apply the serum and then use the tool again to push it powerfully through the
Wow.
skin. So
That's
this is
cool.
brand new technology that can be used in dermatology and so many different areas of medicine, probably head to toe. And I had a quick chat with Amy Killen about where she wants to use this ultrasonic
Yeah.
technology. So don't even ask,
Yeah. Amy
she's got the
Killen.
other,
Yeah.
Dr. Killen's got the other head covered,
Yeah. She
but we're
did.
working on the scalp,
She did some stem cells for me a year ago, and I always joke, she's the only woman that's ever put a hypodermic needle into my penis. Yes.
Okay, so
Actually, you know what they did? I think they did my scalp when I was there at
she's a
Docere.
certified hair coach, so she's well qualified to do that
Yeah.
as well. So, but TED, transepidermal delivery, is this new technology. We're one of the first in the country to have it in Boca Raton at the practice, right in South
Wow.
Florida. So that's going to be a little bit different than what most people have heard of in terms of PRP, platelet-rich plasma. So it's kind of like it's just an easier method to apply these hair growth serums. So what's in the serum? Everybody wants to know. So we know that there's like 30 to 50 or 35 ingredients in the serum, and it comes sterile. It was carefully curated in Italy by some very, very clever chemists and researchers. It contains not only amino acids, and other and growth factors like VEGF, which is important for new blood vessel formation and increase in circulation, but it has a thymosin beta 4 derivative. So TB4 is very well known in the clinical literature for hair growth, and probably most importantly, copper peptide.
Nice.
So we're going to deliver a lot of that thymosin beta 4 derivative and the copper peptide and the VEGF directly through the skin, along with amino acids and the stabilizers and such, which keep it sterile and protect from UV light and things like that.
Yeah.
So
Wow.
it's you can't just pull a serum off the shelf and think that that's going to work.
Yeah.
Using TED. These serums
Right.
are very, very carefully created so that they stay where they're supposed to as we're doing the treatment, and obviously they stay well preserved on the shelf as well. This is another critical factor. A lot of people don't realize that some of these components, especially peptides, are very fragile molecules.
Mm-hmm.
And so it's important that they have stabilizers in there.
Yeah. I
Yeah.
remember getting some unconstituted or pre-constituted peptides, like the little powder, and it instructed you when you put the backwater in there to not stir it up, to very gently inject the water in to constitute it. I was like, that's interesting,
Yeah. You don't want to shake it up like,
Yeah, I was like, that's funny,
like a cocktail shaker.
Yeah, exactly.
Yeah.
Exactly.
So it's the same thing. Yeah.
With-
So that's the TED.
Okay. And with the peptides I know with some of this stuff, it's not a one and done thing. I mean, I guess with the transplants, it sounds like it is, and we'll find out. But is the peptide treatments and things like that something that you're going to have to probably have some maintenance with?
Yeah. So all of these therapies that we've talked to up to this point that are non-invasive need to be continued over time. There's no one and done, set it and forget it.
Damn it.
Right? So if you're using laser, you got to do that 5 minutes every night. If you're doing the topicals, it might be once or twice a day. If you're doing an oral treatment, you got to continue that. If you're doing your nutrition, you got to keep up with that. If you're doing, let's say, the TED treatment, that's usually a package of 3 treatments spread a month apart. So you do those 3 treatments. We're going to measure your results. Most patients do great with that for about a year. Some patients might need a touch-up. They may need a booster shot, so to speak. But eventually, you're going to need another series of that to keep up with the hair loss, right? To keep the hair loss at bay.
Okay.
Treatments like what we do that are, let's just say, a little bit more invasive, meaning that we require local anesthetic, like PRP, platelet-rich plasma, using a dual spin process. That's going to be a once-a-year treatment for most patients. So that's going to have a boost for 10 to 14 months. So platelet-rich plasma, your listeners may know, is the use of platelet-derived growth factors from a blood sample that's separated through centrifugation, right? Concentrated to a very specific hair growth recipe, if you will. So we want to get to 1.5 million platelets per microliter or 1.5 billion per cc. We're going to use a local anesthetic block to make it completely painless, and that's it. That injection is going to occur. You're not going to feel any of those injections throughout the scalp.
And
And then
are
there's
those just,
microneedling at that time.
oh, okay. So are they injected with a needle and microneedling when you do
So
that?
it's a layered treatment. So
Oh,
what
okay.
happens? So people say, "Well, I just got my PRP at the Medi Spa. All they did was an injection. They didn't even use local anesthetic. They sent me out." Well, there's a little bit more nuance after doing like 13,000 PRP treatments. We've gone through so many different preparation protocols. We've measured all of these patients. So we know now what the correct platelet concentration is that we want to get to. We know that everyone comes in with a little bit different platelet concentration in their whole blood. So we tailor the spin to create that
Oh, wow.
sweet spot, 1.5 million per microliter or 1.5 billion per cc. And we know we have to create at least 7.5 or more cc's to get a scalp treatment done.
To do the whole scalp.
Yeah, it's
Okay.
a treatment about 600 square centimeters, which is about the
Okay.
size of the palm of my hand plus my
Got it.
fingers, that area.
Yeah.
And we use local anesthetic, so it's painless. I'm always shocked at how many people tell me I had PRP in my local med spot. No, they didn't use any local
Yeah.
anesthetic.
Yeah.
What are they, barbarians? I mean,
That's
this is like
funny.
crazy.
When I had it done, I think they used my adipose and marrow-derived stem cells at Docera Clinic a couple
Yeah.
years ago, but I was totally under anesthesia. I had no clue, and I just came out. I was like, "Why is my head all red?" That
Like, oh
the
yeah, we did stem cell
microneedling and my
treatment.
face. They did the microneedling on my face. But yeah, thankfully, I didn't know that was happening. That would be quite uncomfortable, I imagine.
Correct. So,
Yeah.
so as I say, it's a layered treatment. So we even do laser therapy on the scalp before we even start. And then, of course, there's an antiseptic wash, a shampoo that's performed, and the mapping and the photos and the measurements that we do. The local anesthetic goes in at the same time that we're doing the spin. And so the dual spin process gets us to that high dose, well concentrated, platelet rich plasma with also some of the white blood cells that are helpful. So
Oh, okay.
so a lot of people don't know that the way that we spin also actually contains some of the white blood cells, which I would just say are more like stem cell like. They tend to be like helper cells for tissue
Mhm.
regeneration and repair, and we preserve that in the spin
Oh, cool. Is
as
that to
well as
kind of help it heal up faster and just
yeah.
get
So then the
sealed?
injection occurs. Then we're going to microneedle with some growth factors on the outside of the skin at the same time. So everything that we create in the PRP process that's injected, and then there's a topical growth factor that's also applied at the time that we do the microneedling.
Wow.
So there's a lot of stuff going on.
You guys are intense, man.
The other secret I'll give out today is that for many years we've been using photobiomodulation, which is the use of a variety of wavelengths and colors to treat the syringe before we do the injection.
Oh, wow.
So we've been doing photobiomodulation or PBM PRP for almost 10 years. And not too many people know that. So I just released
Well,
it.
now they
Just,
do a
yeah, no. So we just
couple
made it
of
a little bit public. One of my secrets.
Well, there's a lot to
Yeah.
be said for that. There's this blood irradiation, right? There's this machine, the Hemolumen, where you can have your blood
Yeah.
run through it, and then using methylene blue for different things. You hit that with, red light. I mean, there's definitely something to the photobiomodulation in terms of even before you put something in your body.
No question.
Which is
Well,
super cool.
they've used actually photobiomodulation for stem cell therapy to activate stem cells to release growth factors, and that does the same with platelets. So we know that those specific wavelengths of light have an impact on the live cells and the cell fragments, which are platelets. So there's definitely some impact there. There's mitochondria there that work and do things. So there is some kind of cytokine release that occurs more effectively when you do treat with the photobiomodulation.
That's very cool.
Yeah, which is awesome.
Now
And then the PDO Grow. So
Yeah,
PDO
yeah,
Grow is
PDO
like
Grow.
the next step. So that's
Okay.
so PDO Grow.
There's more steps above what you just said. That sounds
So
sounds badass already.
that PRP which I just described,
Yeah.
that's our basic PRP.
Oh, okay.
That's basic, man. That's what we've been
Okay.
doing for 12,000 treatments in 15 years.
Okay.
PDO Grow has been around for about 6 years or so, and that's the use of everything we just talked about with the addition of polydioxanone threads. So those are absorbable synthetic material that's FDA cleared. You put it right in under the skin while it's numb, and it dissolves slowly over 6 or 12 months. And that creates a scaffold, if you will, under the skin that the body works on. And you've done the PRP at the same time. And those two things together give you another big boost of hair regrowth. A
Wow.
little bit stronger, maybe even a little bit longer than just the plain PRP alone.
That's interesting. That's like robotic kind of, superhuman stuff. That's very
Yeah,
cool.
a lot of people know those threads from the changes that cosmetic surgeons will do, like for wrinkle reduction and things like that. They'll put those threads in the
Ah,
skin
okay.
or to pull the skin in different ways for tightening purposes. Obviously, we're not looking to tighten your
Yeah.
scalp. We're not really interested so much in the collagen production. We're more interested in the growth factor release and also the new blood vessel formation. And that's what happens with PDO Grow. So
Okay.
that's kind of like the upgraded version of PRP. Also takes just about an hour, and there's really no recovery or downtime from that either. Your scalp will be a little bit pink, a little bit numb for a couple
Yeah.
hours, and that's it.
But you're not walking out with stitches.
No, heck
I
no.
mentioned methylene blue,
Yeah.
and have you ever heard of that being used in conjunction with any sort of hair protocols?
No, I'm not super familiar with
Yeah.
that, but if you've got some information, I'll
I
happy to
don't I
take a look
don't
at
yet,
it.
but
Yeah, I
it
don't
just
know.
seems to do so many things that
Yeah.
I'm surprised it hasn't somehow crossed your path because it just I keep just hearing more and more benefits of it. It's just
S
such a strange and fascinating compound.
Yeah, no, I don't I'm not sure of what the effect would that be on hair
One effect
growth.
for
I'll
sure would be it would turn your whole damn head blue for
yeah,
for quite a while, probably a few weeks. So
I can
maybe
understand.
that's why we haven't heard of it.
That could be the reason, yeah.
In terms of the okay, so we covered the peptides, the PRP, the PDO grow. What about placental matrix, exosomes,
Mm.
stem cells, the kind of next level of those type of
Yeah.
compounds?
So, placental matrix or perinatal biologics have been available for many, many years, and that's included with our PRP.
Oh, okay.
So we do that as our standard. The placental tissue adds a biologic scaffold, right, as opposed to what the polydioxanone is, which is a synthetic scaffold. So in regenerative medicine, you have cells, signals, and scaffolds, and that's kind of like the troika or triad, if you will, that makes things work in the field of regenerative medicine. So we learned that early on, and the placental derived tissues were essential in potentiating and prolonging the effects of the PRP. So we've done that.
Okay.
Exosome therapy is really the rising star, right? Because we're talking about nanoscience now. Exosomes are, if your listeners are not clear on that, these are the little messages that come off of cells. And we're interested really in the messages from stem cells and how they tell the body to repair, rejuvenate, and restore function and form. And so stem cells can be, as you know, harvested from your bone marrow, your adipose tissue. Um, but exosomes can come from anywhere. There are exosomes in breast milk, in semen, in urine, you name it. There are exosomes all over the place in your blood. There are platelet exosomes. That's what contain the growth factors. So exosomes is just a general name for these little bubbles that are very tiny that used to be thought of as just cellular waste. And now we know these are important communication messages in a bottle, if you will, that come off of cells, by the billions to tell other cells what to do. Sometimes in the local area, sometimes distant.
Got it. So these are the messengers.
Yeah.
Okay,
So,
cool.
like, how does a stem cell that goes into a injured knee or joint or whatever? How does it tell the area to do what it does? Because the stem cell doesn't really become any part of the knee, but it executes the repair. Well, how does it do that? Well, the secretome, the stuff it gives off, is what tells the body to rejuvenate. That's exosomes.
Okay.
So
Cool,
that's what
cool.
we're after.
Yeah.
Right? So today, if you're not really interested in, getting your bone marrow or fat harvested to, get a stem cell therapy, then we can go to a laboratory and find one that is basically creating exosomes with the correct payload, correct concentration, sterilized and purified and quantified and then frozen, and they send that to us. So exosomes come in little vials, 50 billion in a vial that's smaller than my pinky,
Wow.
and that can be applied to the scalp. And so, at this moment, let's call it topically applied exosomes. We could do it with TED, as we talked about. We can apply exosomes that way. There are other ways to apply exosomes under the skin.
Okay,
Mhm.
cool, cool. Then you mentioned a couple times the laser and the red light, and I was looking at your booth again and saw I've seen like red light little helmets,
Mhm.
but yours is like super hardcore. It's like lighting up your whole booth. So whatever that thing is, it's doing something.
Yeah.
What's the kind of evolution of laser treatment, red light directly on the scalp, and how does that work? How effective is it? Does it need to be combined with some of these other things
Right.
in conjunction, or would that alone do anything for you?
So 2 decades ago, I would have told you there's no way that red light would do anything on the skin. Nobody taught me that in medical school. What the heck are you guys talking about? Photosynthesis is for plants. Well, no. Today, we know that red light has a very powerful effect on animal cells and especially the mitochondria. And they've figured out exactly how that works. How does red light change the function of the mitochondrial membrane to create more ATP and change the gene expression in hundreds of different genes to create a cascade of not just energy, but anti-inflammation and pro-survival and anti-apoptosis, which is cell death. So there's like all of these things that happen from red light therapy that we know about today that we didn't know before. On the scalp, you want to apply red light therapy, which is a great non-chemical, non-invasive, no side effect treatment with the correct dose. Unfortunately, what you've described is that you've seen over the evolution of these devices. Now we have a plethora of consumer devices, which are out there in the marketplace, Amazon and whatnot, that are just very weak, very clunky. I mean, yes, you can get a result from them, but it's like driving a Honda instead of a Lexus. I mean, it's a different level. You want something with a little bit more horsepower. You want something that's going to be a quicker treatment, get you there faster. Something that's going to treat all of the areas of the scalp, not just a spot treatment. And that's what we've designed in the Turbo Laser Cap. So the Bauman Turbo Laser Cap is the premier device on the market. We worked with Dr. Michael Rabin and his team of engineers and scientists to re-envision and re-engineer the laser cap. He's the original inventor of the cap.
Oh,
That
wow.
was the laser. And so Dr. Rabin and I, working closely, we developed what you see as the turbo laser cap, which is completely collapsible. So it's totally portable. It has over 300 laser diodes in it. It has a 5-minute treatment time. It has a rechargeable battery pack. And it has a
Nice.
lifetime warranty. So hopefully it'll be the last one you ever need, as opposed to these Amazon ones, which are, yeah, sure, they're a lot less expensive, but they're basically like disposable. They're going to crack and break, and they're not going to fit in your luggage. And not
I
gonna,
like the rechargeable thing too, because I would prefer to not put something plugged in on my head for very long. We were talking about EMFs earlier,
yeah.
a lot of these health devices. I mean, they're starting to figure it out, but a lot of them, also have some negative effects because you're, plugging your head into the wall.
Oh my gosh. Well, there's plenty of lasers that are out there, again, in the consumer realm that you literally have to sit in a chair and plug it into the wall
Yeah.
for it to work. And you're just sitting there with all of that
Bad
going
idea.
on. So having a portable battery pack that you can, recharge when you're not near it
Yeah.
is important, and then use it, and having a quick treatment time. So you're not under this treatment for 20 or 30 minutes. It's literally 5 minutes, you're done.
That's cool.
So I do
That's
it at
cool.
night, right before bed. I find the red light to be soothing, relaxing, as you can imagine. And of course, I feel that pulsation of circulation in the scalp, especially if I've applied a topical with it at the same time.
With this, what's it called? Your
Bauman Turbo Laser Cap.
Turbo Laser Cap.
Yeah.
And can a consumer just go buy that from you, or do they have to be one of your patients and go through
Well,
your
so we do
treatments?
have it on our e-store at
Oh, okay.
baumanmedical.com. They can go there, shop.baumanmedical.com, and see that and purchase it. And actually, when they purchase that device, it comes with a consultation.
Oh, okay, cool.
So I don't recommend that people, do this without guidance, because,
Right.
sometimes they're going to miss the mark and they may become disappointed, or they may not realize they have underlying conditions that could have been rectified to improve their situation. So I always tell, the general public, really just get a consultation.
Yeah.
So you know what the situation is, get a correct diagnosis, because a lot can be learned in a very short period of time. I mean, 30-minute call on Zoom, and I learn everything I need to know about your medical history that could be impacting your hair. And how can I do that in 30 minutes? Well, it's because I've done it like 30,000 times.
Yeah.
You know?
Let's hope you figured it out by now.
Yeah, I figured it out. Yeah, my parents say it's a 25-year overnight success. So they
That's
figured it
funny.
out. Yeah, I figured
That's
it out.
funny. All right, then let's get into the actual transplants. And to some people listening, they're probably thinking about, 20 years ago, whenever it was, and you would walk up to someone and you're like, oh man, he has really bad implants. Like, it would just look like little
Plugs, yeah.
Yeah, plugs, right? Where it just doesn't look natural, and you almost think, you might as well just let it go. You know what I mean? Because it just looks
Nobody wants to look
funky.
worse than the natural condition, right? That's like the worst nightmare, right? You have a cosmetic defect, you're looking older, and then all of a sudden you've taken some action and it looks awful and terrible. Why would you ever do that? Well, that's the thought that I had, over 25 years ago when I first met a patient who had had a hair transplant. But then I looked at him, I'm like, where did you have your transplant? And, he told me that the frontal hairline had been transplanted. I'm like, wow, it looks 100% natural. And he said, that was the idea. So that's how I got interested.
Oh, cool.
In addition to how it changed his life.
So
right?
take us back to kind of the inception of the hair transplant. Was it I have a sense, probably a bit more primitive and, if not barbaric, in the beginning. I remember
Yeah.
people would be missing part of their skin in the back of their neck and weird
Yeah.
stuff like that.
So hair transplantation in the US goes back to the 1950s and 60s when Dr. Orntrek first did hair plugs. So those, imagine a instrument to take a punch of skin that was about the size of a diameter of a pencil eraser, right? That's a big plug of skin that contained 30 or 40 hair follicles. And he would swap out the bald spots with those plugs of hair. And so what you got was this like cornrow appearance that was very unusual looking.
Yeah.
You know, Joe Biden had those back in the 70s. Go look it up. You can see the plugs when his hair was
I'm
dark.
sure he did.
Yeah. And so the technology evolved, obviously,
That's
into the
funny.
80s and 90s into strip harvesting because the technology worked, right? The idea, the concept is that we're taking the hairs that are immune to male pattern or female pattern hair loss and from the back of the scalp, that's where they're DHT immune, and we move them into the thinning or the balding area where they'll live and grow forever. So that's the whole idea.
Okay.
His was a proof of concept that it worked, but it just didn't look great. So the plugs evolved into a strip harvest. So the old style strip harvest was literally the removal of a strip of scalp, and then the gap was sewn shut. So you'd have these stitches or staples in the back of your head, and that would leave you with a linear scar. Still, it worked, right? You got the follicles, which then needed to be dissected under the microscope and implanted, hopefully in an artistic way, so that it would look normal and natural. And again, they would live and grow there forever. Well, back in around, let's say, late 1999, early 2000s, myself, along with a number of other physicians, maybe about 6 or 8 of us around the world, were pioneering a newer technique to try to take the follicles and the follicular units, which are the natural groupings of hairs, out of the scalp one at a time. How do we get those follicles out without having to use a scalpel or stitches? How do we take the follicle by itself without having to worry about a visible linear scar being left behind? And that technique evolved into what we call follicular unit extraction, or FUE. Some people call it today follicular unit excision, but you still have to get the follicle out. So you have to extract it at some point. And so all of that technology started really, really slow, meaning that we couldn't move a lot of hair. It was not very efficient. It wasn't super accurate. But over time, we got better and better and better. And then 2000, and then there were some new mechanical devices. I'll give you a name. Neograft, for example, was one of the first mechanical tools that really accelerated our speed and accuracy. Basically, because it looked and designed like a dental drill. So it had ergonomic features and functions. It was smaller, less invasive, minimal depth, things like that. And that totally superseded like some of the manual devices that I created way back in the day, like the Bauman Medica, which was the first commercially available device to help surgeons get the follicles out one at a time. Well, obviously, getting to a mechanical tool was a quantum leap. And then robotic devices came on the market, FDA approved in 2011, and we were one of the first to have robotic FUE, follicular unit extraction, in the practice. And today, we don't use the robot as much. It doesn't really harvest in all the areas that we need to get to. But we're using manual tools to take hair follicles, not just from the scalp, but we can also harvest beard follicles, body hair if we need to. But the most important thing is that these minimally invasive procedure, obviously less invasive, quicker recovery, less downtime, less pain. You can be back in the gym in 3 or 4 days. All of that means nothing if you don't do it with an artistic eye.
Right.
So that's the key to the whole thing.
Okay.
And that's the problem now that you're seeing, that there's a lot of FUE volume of procedures out there, especially overseas. And we can talk about Turkey and things like that, where, so many of those cases are coming back and the hairline is a straight line all the way across the head. Or they've used the guy's entire donor zone to create like an inch or two of hair in the front. I mean, and the hair is sticking out like a porcupine. I mean, these are disasters that many times cannot be fixed. And that doesn't even go into the fact that they don't give any post-op care and the risk of infection and all these other factors.
Right. So
they're bleeding on the airplanes coming back to wherever they came from.
So is this kind of a medical tourism thing? Like when stem cells were less widely available, people would be going to Panama and Mexico.
Yeah.
And
so in Turkey, there's no regulations. You don't have to be a doctor to do a hair transplant.
Oh my God.
Yeah. So there's just
go to your local rug maker.
Yeah. Yeah.
Oh, that's gnarly.
Yeah. So it's a little crazy. I mean, look, there are good quality physicians out there,
Sure.
but it's the Wild West.
Okay.
So
that's interesting. I wonder why that kind of emerged in Turkey.
Well, it had the support of the government. So the government will actually pay for the flights for the people that come in.
What?
The clinics pay a fee to the government, so the government's in on it. essentially.
Okay.
So there's a lot of different factors.
Okay.
Economic downturn in the area. The Turkish lira, I think, is really gone down a lot over the years. I think so. They were looking to increase that medical tourism, and they're hoping that maybe they package it in with some restaurants and hotels and things like that. I mean, I don't
Okay.
know,
Okay.
but it's basically like Wild West, you know, types of things going on.
Got it.
But I mean, look, women go to Costa Rica for boob jobs and liposuction and things like that, and they can sometimes come back to the U.S. with severe infections and things that the local plastic surgeons don't even want to treat or touch because there's no way to fix it. So you don't want that to happen with your hair transplant.
Yeah.
So it does not. People don't necessarily have to come to me. There are other board certified hair restoration physicians. There are other people in the list of top hair surgeons in the world. There are others that are recommended by American Hair Loss Association or International Alliance of Hair Restoration Surgery, American Board of Hair Restoration Surgery. These are all places to go to find lists of folks. And then you want to do your due diligence. You want to compare.
Okay. And if you're ending up and you've tried, maybe someone's exhausted some of these other options, or they don't even want to try this, they're just like, put me in the chair, fix me, doc. You're looking at a fairly permanent or permanent restoration of that hair. If you move that follicle from a place where it's never going to be lost, are you good to go? And is that hair going to grow like a normal hair?
Yeah, that once that hair is living and growing in that area, it's immune to male pattern hair loss because of where it's been harvested from. So it's durable, it's lasting. Now, things can happen over the course of your life, medications and illness and stress and things like that can affect all of your hair, right?
Okay.
But male pattern hair loss is not going to affect that transplanted hair again.
Wow.
But in order to make your full result lasting, you need to protect the other hair. Because let's just say we're transplanting the new hairline back for you. Well, you've got some hair up in the frontal zone. That hair is at risk. I'm gonna go between those hairs to densify it, right?
Right.
But what if you lose those other ones over the next 5 or 10 years? Well, then I need to come back and transplant again.
Right.
So the best plan of action is taking this approach, which I think is the best. There's this prevention, protection, and then the restoration that occurs, and then the tracking of it over time.
Right.
And that's the key to the whole thing.
Right.
That's why patients are happy.
How did you develop the artistic knack that you have?
That's a good question. Well, I was mentored very early on. Um, I was mentored very early on by a plastic surgeon, a very prominent plastic surgeon on the Upper East Side of Manhattan when I was a teenager. And he always said to me, no matter what kind of procedure you're doing, if you want to engage art, you have to be a student of nature. And so I always remember that. And so if you're going to recreate a hairline, you need to know what a natural hairline looks like. And a hairline is not just the hair on the top of your forehead, but it's also, for example, the hair on the side, on the temples. We call this the temporal point area. And so if we're going to do a hairline and the temporal points have receded, we have to build that forward as well. So I think it's just being a student of Mother Nature, looking at youthful hairlines, looking at all the different types of hairlines. Well, how does Mother Nature create a cowlick, a widow's peak, a receded look from the time that someone is young, or a more flatter or ethnic hairline? Looking at all of these things and then looking at the patient's anatomy. Using all of the sights and sounds, right, as we say. So, we might have you bite down into your jaw to find out where the temporalis muscle attaches to the bone, right? That'll reveal the temporal point. Raise your eyebrows to see where the hairline used to be. Look for little hairs under the microscope and see, where the hairs were. Look at their direction under the microscope. So you need good lighting. You need good microscopy. You need to be attentive to detail.
Right.
That's the whole thing. I mean, if you put the hair in like a porcupine, it's going to look terrible.
Yeah,
I
think that's the thing I'm kind of really in awe about the work that you do is, as someone who has a very difficult time with very tedious, detailed work, I'm like broad stroke kind of artist. Throw the thing. Yeah. When I think about just just the tedious nature of like, well, put one in, put another one in. It just seems so slow and
so
you have to be so deliberate.
Yeah, I mean, I guess the phases of hair restoration in terms of the transplant procedure. There's the way that I perform it is I make all of the recipient sites at the same time.
Okay.
So it's not like a stick in place.
Got it.
So I'm going to make all the recipient sites. And that's kind of like, I always think of it like a puzzle. And I always did a lot of puzzles when I was little. I also did a lot of like plastic models, like the
Yeah.
glue and paint and
This
stuff. You know,
explains my fascination with you because if you made me put a puzzle together, I would probably throw this table over the balcony. Like I would
yeah.
get so frustrated after the first 3
S
pieces, you
Yeah,
know?
so, yeah, my family, I guess when I was little, my dad and I, we always did, like, projects like that. We were always my dad's a dentist, and, he's still practicing after 50 years, still in New Jersey.
So a guy that knows detail work
Yeah,
also.
so his
Yeah.
life, his work is right in this small space, right? And I
Yeah.
guess I inherited some of that. And my
Yeah.
mom, was a teacher and an oil painter as well. So I think what do you get when you cross an oil painter with a dentist?
You.
A hair transplant
Yeah,
surgeon.
totally.
Yeah, I don't know.
Yeah,
That's how it
yeah.
worked out, I guess.
Yeah, because 'cause
You
you're
know?
working in a small space and you're doing something that does require some artistic vision, right? Yeah, it's
Yeah.
not just mechanistic, you
But it
know?
but that's what's so fun about what I do. So there's 2 parts, right? So there's the
Okay.
puzzle part of it, which is the physical work of making the angles and the positioning so that eventually when the hair grows in, it looks amazing, right? So that's like the landscaper planting the trees, and then 6 months later, he looks at the result, right? So the payoff, 12 months later, I get a chance to see the result, right? Evaluate it, and I'm critical, very self-critical about the results as you know, if I wanna make changes to it, of course, I'll talk to the patient about that. But then also, I get this amazing benefit from the patient, right? Whose hopefully life has been changed for the better from the restoration. They're looking better, they're feeling better. They were concerned enough to undergo a procedure to fix this. Hopefully, I've accomplished the goal or gotten them towards their goal. And
Awesome.
that's the payout. That's the
Yeah,
payout for me.
totally.
Yeah.
Yeah, my former life here, in LA, I was a fashion stylist, so I dressed, celebrities and musicians and stuff for music videos and things like that, and
Mhm.
there's all this work that goes into it up front, which is really kind of stressful. I mean, there's creativity involved, but, I mean, it's a lot of running around in traffic and
Right.
logistics and budgets and all that. But that moment when you turn on the TV and see your actress walking the red carpet, or you go to the newsstand and pick up the magazine that you style. Like there is
Mhm.
something really satisfying about seeing the finished product
Yeah.
when you put, a lot of work in, especially, tedious or stressful or both
Right.
work.
Well, what about when you did that for your clients and like, they come in disheveled, whatever, ragged off the street, and then you like style them, you put them in all those clothes and makeup, whatever hair, and then you like turn the mirror around, right? Do
Yeah.
they have to light up, right?
Totally. Well, you hope so, right?
I
Yeah.
mean,
Yeah. I mean, when you finally nail it, right? Well, the difference between what you're doing is you get kind of one shot at it, or at least
yeah.
one shot per procedure.
Yeah.
With me, you turn them around and they're like, I don't like this dress or these shoes, and then, but when you find the one, when you
Okay.
nail it, yeah, your client's like, oh my God, I didn't know I could look like this.
Right. So
That's,
that's more instant gratification. So I'm a little bit
yeah,
jealous about
yeah,
that you can instantly change that around,
yeah,
whereas my work, it just has a longer feedback loop, it just takes longer to do
yeah.
that.
That's very cool, man. Well, geez. Oh, no, I thought we are done. There's one more question for you. What about eyebrows and eyelashes?
Yeah, so wherever there's hair, we're there, man, So eyebrow loss can happen from trauma, from injury, and we've done a lot of those cases pro bono. Someone attacked by a dog or a car accident happens, and it removes the eyebrow area, creates scar, or they've had some kind of a radiation therapy. I did a young girl pro bono who had radiation for cancer, and her eyebrow and eyelashes were completely obliterated. And so we use the hair follicles from the back of the scalp to restore the look and the shape of the eyebrow area. And I can also do eyelash transplants for women.
Really?
I was the
Wow.
first, board certified hair restoration physician to do a live surgery regional workshop. Actually, here in Los Angeles, I'm trying to think of the year now. Maybe it was like 2006 or something like that, where we actually taught physicians from all over the world, 12 different countries, how to do eyelash transplants using this very innovative technique.
Wow.
So I'm like, yeah, that's one of my claims to fame is eyelash transplant surgery. Again, taking the follicles from the back of the scalp and implanting them 1, 2, or 3 at a time into the eyelid.
Is the person awake when you're doing this?
Yeah, they're awake, a little sedated,
Okay.
relaxed, they're not knocked out at
Okay.
all.
Like a little bit of ketamine or something?
No,
I'm imagining that to be a little uncomfortable,
it's actually not so bad.
Okay.
Literally, to numb the lid because the skin is so thin, it takes only about 20 to 30 seconds to numb the lid.
Ah,
And
okay.
so there's a careful technique that we use with an injection process with a computerized syringe.
Really?
Yeah, to actually inject that area,
Wow.
carefully and safely, of course. And
Yeah.
then there's a really nuanced technique that I learned from a Brazilian plastic surgeon who's out of Sao Paulo, who is my eyelash transplant mentor. Um, and I ended up taking his technique a little bit further. He was implanting one lash at a time. And I ended up doing a few different things differently. I ended up doing 2 or 3 lashes per insertion. And now I can take the eyelash grafts from the back of the scalp without trimming any hair. So we don't have to cut that linear scar or cut out a strip to get a linear scar anymore.
Wow.
We can actually take the follicles without trimming any hair.
Damn.
But
That's
both
rad.
eyelash and eyebrow transplantation come with scissors.
Are you serious?
Yeah, because it grows super
That
long.
is
Yeah. So
funny.
you have to curl the lashes or trim the brows.
I
and
bet
things
women
like
would be
that.
stoked though, because they could have long ass lashes.
Yeah, so we call it like the Hollywood look, right?
Yeah,
Is when
yeah.
it's like really, really long. And in fact, there's a whole cottage industry for perming and curling lashes.
Yes, the woman who checked me in here at the hotel, her eyelashes, I complimented her. I mean, they were, I want to say they were like a half inch long. They were
Okay.
huge.
So unless
Yeah.
she had an eyelash transplant,
No, I think they were.
she was probably, she's probably wearing falsies, right?
Yes,
So
yes.
fake eyelashes, right?
Yes, yes.
So that's, of course, another thing.
All right, man. Well, listen, I think we did it. I got one last question for you.
course.
Who are 3 teachers or teachings that have influenced your life that you'd like to share with us?
Well, first of all, I have to say that probably the biggest influence, and we're here at the Biohacking Conference, just in terms of my changes in health over time, has been Dave Asprey. Years ago, when I met him at the American Academy of Anti-Aging Medicine in Vegas, this is probably in 2015, 2016, I saw him for the first time in keynote address, and he was talking about, buttered coffee and dieting and things like that. I'm like, buttered coffee? Like, what is this all about? And within about 6 months, I was trying it, and it was at the advice of my personal trainer, who was trying to help me kind of get more in shape at that time, and that was a big change for me. And so, kind of stepping me on the path from what I've been doing, like health stuff for like 15 years, going to the A4M, American Academy of Anti-Aging. That I was on the path. Well, I wasn't, but this new path of biohacking kind of taught me to take it deeper. So that's been a huge influence on me, and just introducing me to podcasts and things like that, and really just experimentation, see what works. And of course, as you know, all the wearables and things like that, the lifestyle changes that we make. It's just been an incredible journey, and, just kind of bolting on things that work and removing things that don't, and trying things, it's like always a work in progress.
Yeah. I'm
So-
familiar with the tinkering you speak of.
So always tinkering. And so I do thank Dave for that. And of course, he became a patient of ours. And so I was super excited to do his hair transplant, have him in the chair to keep his hair looking good until he's 180. I just hope to be around
Right.
as long as that, to be able to take care of his hair when it's 180,
Right.
So, I mean, I plan to ski when I'm 130. So maybe I'll get at least most of the way there.
Nice.
So that's probably the main one. My dad was a huge influence on me. Obviously, he taught me a work ethic, and he's obviously still in practice, as I said before, 50 years of doing his thing. But also, he was actually one of the people that introduced me to alternative medicine. And so, way back when I was an intern in general surgery, cut it out, suck it out, burn it out. My dad always had kind of other businesses, everything from ad specialty items to health and wellness, actually, in addition to his dental practice. He told me he was getting involved with a business that was based out of Japan, that was making devices that were magnets for pain. And I probably didn't hear him correctly. And I said, "What are you doing?" He's like, "Oh, well, biomagnetic treatments." And I said, "MRIs?" And he's like, no. These are static magnets that you put on the outside of your body, and they affect people's pain. I'm like, I don't think that's going to work. That can't work. What's the physiology of that? No one ever taught me that in medical school, because I'm, of course, graduated within a year, right? So I thought I knew everything. And he's like, okay, well, stay tuned. Anyway, so what I learned is that, and of course, I became a user of those products, magnetic insoles, and I used the static magnets for headaches and things like that through my residency. I became aware that there were things that maybe outside of my medical training that actually had a physiologic effect on my body and other people's bodies, especially in areas of pain.
Yeah.
Yeah. So that was just an eye-opening thing, where you think, like, you graduated medical school and you're doing surgery at, a top hospital in New York City, that you just know everything about medicine, when actually probably the opposite is true. They've basically focused and guided you down into some tiny little corner. And so, that's why I always encourage my colleagues, who poo-pooed laser light therapy. And now, of course, we've got the metadata analysis of all those clinical studies that showed that it worked. Well, I tried it out like 20 years ago and it worked, but now we have the data to support it. PRP, Oh, PRP, it doesn't work. Well, yeah, it does, but you got to use the right dosage and things like that. You know, hair transplants. You're going to go do plugs? What? No, I think that there's a way that we can do this to make it look natural, artistic. So it doesn't look like something artificially created. And so, I think that that's important things that my dad taught me, and from my mom, the artistry and the empathy. The compassion for patients.
Yeah.
So,
Awesome,
those
man.
are my three heroes, I would say. If I can add a fourth, then it would be my wife, because she's the yin to my yang.
Yeah.
She's the
You're a
the
high energy
Virgo
dude. Like
discipline.
just the work that you're doing, I'm like, okay.
Yeah.
Yeah, you're prolific.
So she is the solid support, the cement that holds the family together. Really the lion's share of the work in terms of like raising the two boys. Now we're empty nesters, and so it's a really exciting time. But keeping everything all together, allowing me to be so engaged in the work that I do, but also have that family balance at the same time.
Awesome.
And so
thanks for sharing
would
that.
be-
You're making me miss my wife, man.
Let's give her a call. Let's FaceTime.
Yeah, I will. I'm
I'm going to do it right after.
I should do that on the podcast
Yeah.
sometime. Hey,
So
hon.
thank you, Karen. Yeah, for everything that you do.
Right on, right on. Well, man, thank you so much. I know you got people to see, places to be.
sure.
I appreciate you taking the time today, man. I learned a lot, and I'm so happy I finally got to cover this. Like, I feel very comprehensively this topic that I've just kind of touched on here and there. But I always like to find like the man or the woman
Yeah, for
that's
sure.
going to like deliver the whole package. So thank you so much.
Well, we just scratched the surface today, obviously.
All right, man. Thanks so much. We'll see you
My
soon.
pleasure.